so follow me. So it's recording. Okay, how many of you guys finished your reading? Everybody read? Who's still having issues getting on to Connect? Anybody having issues getting on to Connect still? Doing assignments, stuff like that? Okay. So, if you guys are having issues with that, let me know. I can help you get on to Connect if you're still having issues. It stopped. This could be a really long class if this keeps doing this.
Probably just wear your shield.
Yeah, no. I don't want to wear the shield. Can you guys hear me okay? Understand me all right? Shut up. Okay, so let's just jump right into chapter 2. Most of you guys have or should have read chapter 2. So you kind of have an idea what we're talking about. Remember, I'm wanting to have kind of a discussion, not necessarily lecture the whole time. So if you guys have questions, shoot them my way. Okay? So, first things first. When we talk about athletic training, it kind of breaks it down into different categories as far as on the education side. So we have our program director. Program directors are responsible for the whole entire athletic training department. They're in charge of the athletic training education side. Remember, we talked, there's a difference between athletic training program and athletic training education program. What's the difference? You guys remember?
The certification?
Okay, yeah, so the KD accreditation, okay, that's the big difference, okay? So, the program director is in charge of the ATEP, okay, the Athletic Training Education Program. Then we have the clinical coordinator. Clinical coordinators break down and decide where everybody's going to do their rotation or what sport they're going to be on. Your clinical assignment, okay? So, I may say, let's say I'm the clinical coordinator, and I'm going to say, Ryan's going to go work, he's on soccer this year, okay? Let's just say. That would be me saying, or figuring out a clinical site for him. Or where a lot of schools will do an off-site rotation. So, when I went to college, we had, the first 2 years you were on campus, you did all the sports on campus, and then you do an off-site rotation. So I did a clinical rotation at Hutch High School. And I worked football at Hutch High School, so that was my junior year. That would be the clinical site. Okay, so I had a clinical coordinator at Sterling that coordinated Hutch High School, and then Nickerson High School, and Lyons High School, wherever we went for our off-site rotations. Okay, so they devise those plans. Okay, and then obviously your faculty. That's just going to be your teachers, the people who are going to teach you, kind of like I'm doing. Now, you have people that will double dip, or they'll do both. So, my program director, Sterling, he was the program director, and he taught. Okay? So he kind of did both. There for a while, he did all three. So he's the program director, he's a clinical coordinator, and he taught. Okay? So, until he hired someone to do clinical coordination, he was doing all of that. Okay? When they first started out, were small, he was doing all that. Okay? And then your preceptor. Your preceptor is faculty or staff or adjunct allied health professionals. Okay? So maybe not a full-time allied health person or an athletic trainer or somebody doing sports med, but they are providing instruction. They're providing the competencies and the proficiencies. Okay? So, for those of you that are down in the athletic training room every day, we have 2 Wichita State students, correct? That come. They are doing a clinical rotation, so their clinical coordinator has set up an off-site rotation to Butler. Now they've got a bunch of off-site rotations, so their clinical coordinator is very busy at coordinating different sites. Amanda and I are preceptors, because we are responsible for those 2 as far as their education while they're here, getting experience while they're here, covering the proficiencies and the competencies while they're here. Okay? So, Amanda and I are preceptors. I teach, so I'm part faculty. Clinical coordinator, we really don't have that here. Okay? That would kind of maybe dip into field experience a little bit, where I try to coordinate when you guys are coming down and get hours for those of you that are in field experience. Going off to offsite rotations, doing stuff like that, which I'm hoping we can do this year. Okay? So we really don't have here a program director. Okay? Now, TC's the AD. He's also sports medicine director, what have you. So he's in charge of the whole entire program, but he's not really like a program director. Okay? He's not necessarily in that role because we don't have that education side where you can go off and get certified. Now, we have the education piece to transfer on to another school, but you can't leave here and go on and get certified. You can't graduate from Butler with a degree in athletic training and get certified and sit for your exam because we're not KD accredited. Okay? And then clinical instructors. Those would be like, we call them CIs. Okay? They provide direct supervision of the student in a clinical experience. So they may not be a certified athletic trainer, but they're providing experience. Okay? So, give you an example. Emily, who's the PT that comes in Tuesdays and Thursdays. She would be a CI. She's not a certified athletic trainer. Well, she is, but she doesn't practice as an athletic trainer. Okay? So she would be a CI because she's providing direct supervision to you guys, giving you instruction on how to do things. So she would be a CI. Does this all make sense? Okay. And don't worry, I want you guys to take notes. Don't worry about writing down every little detail on the slide because it will be posted. You will have access to the PowerPoints, okay? Write down what you guys think are important, okay? And I think I hit on this last class. Take notes on paper because I may or may not, when we have tests, let you guys use notes. Can't use computer, can't use phone. That's why I ask you guys to take notes, okay? So, NATA Educational Council. What this is, they set up the educational guidelines for us to teach. Okay? So there's standards that we have to meet to teach. Much like Katie, where they have guidelines, they have accreditation that you have to meet when you're in an ATEP. Okay? Educational Council sets the education competencies and clinical proficiencies. So they're going to set the things that we want you to learn, and they're going to set guidelines for how you do them. So everybody will learn in here the same exact way to tape. When we cover the taping portion, everybody will learn in here the exact same way to tape. Everybody will learn the basket weave. Okay, everybody's going to learn that. However, once you get to taping, once you have learned how to tape and you get the premise of it, I don't do a basket weave anymore. I do a continuous. So a basket weave is single strips, tear it every time. Okay? But I don't do that anymore. Everybody tapes differently, but we all learn how to tape the exact same way. But we all do it different now. Because we've developed our own ways of doing it. It's the same exact tape job, just done differently. Okay? Okay, so ATEPs must use these competencies to develop the curriculum. Again, athletic training education program, they have to use this stuff in order to graduate. Okay? In order to get that degree in athletic training. Okay? So, Katie basically took all of the educational information from the NATA. Okay? So the NATA basically set a guideline, and Katie is sticking with it. That's what we have to follow so you guys can have that education. The education that they set forth that they want you to have. Okay? So competency breakdown. Competencies are cognitive. Okay? So it's what I'm teaching you. Okay, I'm going to teach you, when we cover taping, I will run down a list of how you tape. I'll tell you how to tape, and you may get the idea of how to tape. Okay, and you may know on the worksheet that I'll give you guys, you may know I need two anchor strips, 3 stirrups, 3 horseshoes, and what have you, and then go on and on. Okay, but a proficiency is how you do it, how well you do it. Okay, so that is a proficiency. Everybody understand the difference between competency and proficiency? Okay, so those are big things with NATA education requirements and KD accreditation. And why did this just stop following me? Oh, whatever. I'm going to say there. There we go. All right, so moving on, psychomotor domain. So this is kind of like your proficiencies. Okay, so with taping, you can have the cognitive, the memory or the mindset of knowing how to tape, okay? But then, like I said, the proficiency is how well you tape. Now, when you're taping, there is muscle memory, okay? It's very, if you know how to tape correctly and properly, you can do it just by knowing where you stand. Once you stand somewhere, your body will remember what you're doing. Okay, your body will remember. That's what we call muscle memory. Okay, so when you hear people say, "I can tape with my eyes closed," yeah, they probably can, because they know where to be. They have an idea. Okay, the ankle is about hanging over the table about this much, and they can just kind of feel where they're at. Okay, so that would be our psychomotor domain motor skills. Us kind of knowing what we're doing and our body remembering the steps that we need to take. Okay? Proficiencies, we already talked about that. Okay? Clinical education experience. Big thing that I like to do here, and like I said, we're trying to do here with our field experience classes, is having those off-site rotations, okay? Having that experience somewhere else, so that you can get the knowledge elsewhere, okay? You're still getting the knowledge here, but now we're going elsewhere to get knowledge. You're learning a different way. That's why clinical rotations are very important. I don't know what the deal is with this thing.
It's probably your mask.
Probably, but I'm not wearing the face shield. Sorry, guys. It was following me for a while.
Yeah.
So that's why having clinical rotations are very important. Okay, to get that experience elsewhere. Okay, to learn other ways of doing it, because I may do things differently than my high school athletic trainer does things, but he's the one that taught me how to do it. But now I may do them differently. Okay. Catherine and I had the same athletic trainer in high school. She learned she learned from Danny, but now when she goes on and becomes certified, she may do it completely different. But she got the baseline from Danny. That's how I want you guys are going to get experience every other place. So you're going to take pieces of what you learned at Augusta or El Dorado or Circle or wherever you've been, and you're going to kind of take all those experiences and figure out which ones you like and how you want to do things your own way. But we're all going to learn it the same way, like I said earlier. We're all going to learn it the same way first. And then we can determine as you move on in athletic training the way you want to do it. Okay? It's still going to have the same premise, but it's different. It's like I said, everybody takes different. Everybody evaluates people differently, but you get to the same point. Okay? Clinical requirements for athletic training, for an ATEP, for a school that is accredited, that's KD accredited, you have clinical requirements. You have to have formal instruction, which is what we're doing now. Okay, it's formal instruction. And then you will have like clinical instruction, maybe down in the athletic training where you're doing labs, okay, you're doing stuff like that. That would be more of your hands-on, okay, whereas this is going to be the structured classroom where you're sitting in the class, you're listening to a lecture, you're asking questions, stuff like that, okay? All right, so me being a preceptor for Wichita State, okay, I have to follow guidelines. I have to follow guidelines that Wichita State sets forth for me to be a preceptor to their students. Okay, so I have to do a preceptor training. Everybody that is a preceptor has to do a form of training in order to have students. Okay, so you got to do a form of training. Okay, preceptor must consistently and physically interact with the student. So, can't just let the student do their own thing, okay? I'm not, you guys that come downstairs, right now, you guys are kind of just hanging out, studying, talking amongst each other, because we don't have much going on. But once we have stuff once we have practices and stuff going on, we have to come out and be with you guys when athletes come in. We'll go out to practices with you guys. What have you. We directly supervise the athletic training student. We also directly supervise, as the preceptor, the students from Wichita State. Okay, we directly supervise them. Okay? Theoretically, the ratio for a preceptor to a student is 8-to-1. Meaning for every 8 students, there must be 1 preceptor. Okay? That works at a lot of places, but not every place. Okay? Some places may have 1 certified and have 25 students. Sorry. And that's too much. Okay? That's too much. But sometimes there's no way around that. Okay, there's no way around doing that. Whether financially school can't afford to hire another full-time athletic trainer or whatever it might be. But in the terms of being KD accredited, this is what you need to have, 8-to-1. Okay? So an 8-to-1 ratio. So 8 students to 1 preceptor. When I went to school, I had a total of 25 students in my class. Now that was at every level 1, 2, 3. Okay? So not 25 in my graduating class. I only had 6 in my graduating class. But we had 25 total in the athletic training program and 6 certified athletic trainers. So we had that ratio. That was fine. We had that ratio. Okay? But like I said, some schools don't have that. They may have a much smaller program, so they can't have that ratio, okay? But if you don't meet the 8-to-1 ratio, Katie will not necessarily accredit you. They may come in and say, in order for you to have an accreditation, you need to get 1 or 2 more certifieds on your staff, okay? It's not enough. Because when you're spreading yourself that thin, the education side of it doesn't thrive. Because there's too many of you guys with just 1 of me. Does that make sense? Okay? Okay. So, athletic training and field work stuff. So, the big thing that we need to keep in mind is HIPAA. Medical confidentiality is very crucial. Medical confidentiality is very important. Okay, so when you guys come down to the athletic training room, we have a thing called HIPAA. Who knows what HIPAA is? What's it stand for? Anybody know? Health Insurance Portability and Accountability Act. Okay, so that basically says that we cannot go off and share information about what an athlete that got hurt. Okay, we are not able to divulge that information. Now, if somebody gets hurt out of football practice or a game, coach is going to come to me and say, what happened? I'm going to tell him what happened. I'm going to tell him that, here's what happened, this is what I think. But I can't go off to the media. I can't even necessarily tell his mom and dad. If they're over the age of 18, they're a legal adult. I can't tell them that information unless they have signed a HIPAA waiver and they haven't put mom and dad on there. So my guess is most of you have been to the doctor where they make you sign a waiver and you put who they can release information to, your medical records, correct? So when you do that, they can share those records. But if you don't, they can't divulge that information at all. Okay? So that's the big thing with HIPAA. All right? As I'm sure you've read, we get athletes or patients from everywhere. All different forms of life, walks of life, age, you name it. Okay? One of the things that you guys read about was in the different environments, the different work job settings that we are in, correct? So there's quite a bit. There's a vast array of places that you can go work. So with that, you're going to see all different kinds of people. Okay? I have a buddy who works at Textron Aviation as an athletic trainer. Sounds kind of weird. He works at an airplane manufacturing plant, but he's an athletic trainer. He sits in his office all day, walks around the plant, and basically tells people, hey, if you would screw this on differently, place your arm differently, you're not going to have those shoulder issues. So he's doing more of the PT side. He's doing more of the educational side. Now he does rehab with his patients. Obviously, he doesn't call them athletes. They're his patients or his clients. Okay, but he's a certified athletic trainer. Okay, military setting, law enforcement, you name it. Okay, so when I worked at a physical therapy clinic, I didn't have athletes. I had my patients. Okay, they came in, and I had my patients that I worked with, ranging from 12 to 80. So I was seeing all kinds of different things. Okay, broken bones to cardiac recovery, cardiac rehab after a heart attack, what have you. Okay, all different forms of things. Don't be afraid to ask for help. Okay, if there's something that you guys don't understand or you don't know when you're going through an evaluation, or you're in class and you're doing your proficiencies. If there's something you don't understand, ask for help. Okay, that's what we're here for. You guys aren't going to be perfect at proficiency or competency. Okay, I wasn't perfect when I went through all of mine. Okay, but don't be afraid to ask for help for those things. All right, so asking for help is important. When we're talking about athlete or patient care, okay, be compassionate. Okay, be empathetic, be sympathetic to those patients or athletes. Somebody give me an example of why you would want to be compassionate or sympathetic to an athlete that comes in.
Because you don't know what they're doing.
You don't know what they're going through. Okay? Give an example. Okay? No names. I'm just going to give an example. Okay? A football player last year had a devastating knee injury. Okay? We were up in Iowa, had a devastating knee injury. Chances that he would have probably played football again were about this. Very, very, very small. It was that bad. Okay? Think of, for some of you may know, think of Alex Smith's knee injury that he had with the Redskins. That's what I had.
Washington football team.
Yeah, that's what I had. Okay, that's what this athlete had. Borderline potentially having an amputated leg. Okay? Because if he would have if this athlete would have damaged that nerve or that artery that runs there, you got minutes to do something. Okay, so devastating. Okay, so I know the severity of the injury. He doesn't know the severity of the injury at this point. He gets it, but he doesn't understand that how severe it is. Okay, so he's riding back with me and my students from Iowa in a van. I take him to the hospital. They get him all drugged up, whatever, to come back. Okay, we get back, and I'm talking to him the whole way. This kid, doesn't have a great home life. Football's his way out, basically. And you will find that here. A lot of kids here, football is their way out of whatever circumstances that they have at home. Football is their way out. So I'm trying to console him, be empathetic with him, and be compassionate to him, knowing that he might want to have a plan B. He might want to think about something else. Long story short, he will be back this year and potentially play football in the spring. Okay? We'll see how good he is, but he's able to play. But he pushed through what could have been the end of his career. He just said, I'm not going to do it. And I wouldn't let it. I told him, I was like, you're not going to give up on this. This is what you want, you're not going to give up on it. And we spent all kinds of time down in the athletic training room talking, crying, because he knew that if football wasn't here, he didn't know what to do. He was going to fall back into a life that he didn't want. So he has dreams and aspirations of going Division I and NFL, but for about 6-7 months, he didn't know if that was even going to be a possibility. But because of being compassionate and sympathetic with him, even though I've never personally experienced it, I've experienced major knee injuries, but I have not experienced anything like that. Just being there with him, helping him push through those barriers, he's now going to be back in the fall, and he sent me videos over the summer of him running and cutting and jumping and stuff like that. So that's why it's important to understand your patient. Understand your patient, be compassionate to your patient, to your athlete. Because you don't know what their home life is like, right? Okay. Don't tell them things that you don't know, okay? Don't tell them things you don't know. Know what your limitations are, okay? The other thing is don't do a test that you have no business doing. Don't do a special test that you're not 100% sure you know how to do correctly, okay? Know your limitations. Know when you need to stop. Just because you're certified doesn't mean you know everything. Okay? So know when to stop. Know your limitations. Okay? Don't be afraid to ask for questions. Ask questions. I still do it all the time. I'm downstairs doing an evaluation, and I may walk in and, hey, Amanda, can you come check this out? Can you come do this? I have a couple questions. Can you see if you get the same thing? Or I'm doing an evaluation and Emily's in there. Hey, Emily, what do you think about this? Can you do this and kind of confirm it or see what you get? Okay, so don't be afraid to ask questions. You're going to make mistakes. You will make mistakes. Don't be afraid to make those mistakes. You will learn from those mistakes. Okay, so don't be afraid to make them because they will happen. And don't beat yourself up when it does happen. There was a time, I'll give you an example, there was a time I did an evaluation on an athlete. And it was for a torn ACL. She had a very good mechanism, this athlete had a very good mechanism for a torn ACL. I did the evaluation, tests were negative. It's like, great, she doesn't have a torn ACL. This athlete played, and then at the end of the season, my knee's still hurting. It's still bothering me. So I sent the athlete to the doctor. Sure enough, she has no ACL. It's gone. Not even there. But she played because I told her that I think she can play, and her tests were negative to me. Okay? So they played, but then after the season I find out, holy cow, yeah, it's gone. They need surgery. So that sucked for me when I found that out, because I was like, shoot, I just made a mistake and I could have ruined their career because I didn't know. Or what I felt was negative was not negative. Okay? So don't be afraid to ask questions. Don't be afraid to make mistakes, because you're going to learn. So what did I learn from that mistake? I learned that I'm good. If I don't think, or if I do a test, and to me it's a negative test, more than likely I'm going to get a second opinion. Or I'm going to have them see our doc on Mondays just to confirm or deny what I did. Okay? Confirm that it's torn, confirm that it's not torn. Or I'm going to have our PT do it. So now I'm asking questions. Okay? But the problem is you don't ever want to second guess yourself. Because if you're doing an evaluation on an athlete and you start second guessing yourself, that athlete's going to know that you aren't confident in your skills and your ability. So that athlete's not going to be confident and trust you. Does that make sense? So be confident when you're doing it. Okay? I do an evaluation now, and I may get a positive Lockman's for an ACL, and I'm pretty confident about it, but in the back of my head I'm still questioning, did I get a positive? So I'll just hold on for a second. I want to go get a second opinion. Hold on for a second. But I'm confident about it, and I've built trust with that athlete already. Because that athlete's like, oh, he knows what he's doing. So don't second guess yourself. Okay? Learn by seeing. Learn by seeing, by doing, and hearing. Okay? What I mean by that is, for all of you guys, my students that are on scholarship, for those of you that are in field experience, watch an evaluation. Okay? Talk through an evaluation with someone. Do the evaluation, watch the evaluation, and listen to how they communicate with that athlete. You're going to learn that way. That's how you will learn. Learn by seeing, learn by doing and hearing. Okay? Very, very important, especially in this profession. Be open to all kinds of different clinical experiences. Okay? You guys probably have in your head what you want to do while you're here as an athletic trainer downstairs. You guys are like, hey, I want to work football. That's what I want to do. Everybody that comes here wants to work football. They want to work football. That's all they want to do. But be open. Be open to working all different things. You're going to work football, soccer, cross country, volleyball, baseball, softball, you name it. Everything. Be open to it. Don't close yourself down to it. Don't say, I'm not going to work anything else. If I don't work football, I'm not going to be an athletic student. I'm going to quit. Don't do that. Be open to it all, because you will learn all different kinds of things at those different clinical sites, those different sports. Okay? So be open to everything. Okay? Again, ask. Know what your tasks are. Okay? Know what you need to get done to not, I guess, make mistakes, if you will. Okay? Know what needs to get done. All tasks are remedial or meaningless that you think are meaningless are important to someone. Okay? They're important to someone. It's like Miranda can vouch for this because she was here last year. How many times did we ask you guys to go fill up water or go do laundry?
A lot.
A lot. How many people thought it was stupid and pointless and meaningless? Why am I doing this? This isn't what I signed up for. It's important. I'm not going to ask you guys to do something if I have not done it. Okay? Trust me, when I was here as a student, I did all that stuff. I filed paperwork. I did everything. So I'm not going to ask you guys to do stuff if I haven't done it myself. So they're not meaningless. They probably felt meaningless at the time, like, why am I doing this? But it's not meaningless. We got to have clean towels. Okay, we can't wipe down tables with dirty towels. We gotta have water at practice. So none of that stuff is meaningless. Okay? Jump in, show initiative. Okay? So if you know something needs to be done downstairs, do it. Okay? If you know something needs to get done, you don't need to wait for me to ask you to do it. Do it. You know, one of the biggest things that always would drive me crazy is people would be downstairs and what? Care and prevention?
Yeah.
I come on Thursday. Just lost my train of thought. What was I talking about? Oh, yeah. Come downstairs, we'd get ready for football practice. They would know football practice is at 3:30 or 3 o'clock. So they know what has to get done for football practice. Set up, take all the water outside. Okay? But what's happening? Nobody's doing anything until I get up and say, hey, I need this done. Take initiative and do it. You know this stuff has to get done, right? Well, I don't need to ask you to do it or tell you to do it. Just do it. Okay? So show initiative. Learn from each other. It's okay to ask why. It's the biggest thing. That is a big thing that people are like, well, they know more than I do, so why do I? I'm not going to ask why. I'm not going to ask a whole lot of questions. Why? Why are you doing it that way? Why are you doing an ACL test that way? Why are you taping this way? Why are you doing this to the knee? Ask those things. Ask why. Just because I have ATC behind my name does not mean that I know a whole lot more than everyone else. You guys may not realize this, but you guys challenge me every day by asking questions because it makes me have to answer those questions. And if I don't know those questions, then I'll go find out the answer to give you the answer. Okay, so you guys challenge me every day by asking questions. Okay? So don't be afraid to ask. When you learn something, practice it. So when we learn how to tape, practice taping every day. Get proficient at taping. So practice all the time. Practice makes perfect. You guys are going to struggle with taping if you don't practice. Okay? When you're a student at wherever you go after this, and you're still going to do it here, but you go on to KU, for instance, or K-State, because KU doesn't have a program anymore. So you go on to K-State, and you get chosen to work football. Okay? One of their requirements for football is that you are probably going to have to tape an ankle in under 2 minutes. That doesn't seem like a big deal, but you're going to have to do it under 2 minutes. Why would you think that they would want you to tape an ankle in under 2 minutes?
So know that you practiced it?
Pardon?
So that's to know that you practiced it.
Yeah, kind of. But think about game day.
Get the athlete back out there.
To get the athlete out. They want to get him in and out and get him real fast. Okay? So you're going to they want you to tape an ankle in under 2. Okay? You get proficient at it, they want you to tape an ankle in under a minute. Okay? Trust me, it's not that hard if you practice it. If we were in the middle of football season right now, you guys would see the madhouse that it would be downstairs. Every day, on game days, it's a madhouse. So imagine you guys taping ankles on game day or practice, and you know that they have to be out of practice in 20 minutes, and you've got 30 athletes, 30 football players left to tape. There's 6 of you, so you should be able to knock it out pretty quick. But think about that for a minute. You got 30 athletes that need taped. There's 6 of you. So how quickly would every single one of you need to tape? If there's 6 of you and 30 athletes. Yeah, so you have 15 minutes to get them out to the field or whatever, okay? You're going to have to be quick. I can't have somebody sitting down there taping an athlete and it takes them 5 minutes just to do one ankle. It should take you less than 5 minutes to do both ankles. Okay, it should take you less than 3 minutes to do both ankles, to be realistic. So that's why we practice. That's why we have to practice all the time. Okay, act in a professional manner all the time. Anywhere you are, act in a professional manner. Okay, that doesn't necessarily have to go for athletic training. That can go for life in general. Act professionally. You guys want to be professionals? Act like professionals, right? Biggest thing, avoid relationships that can compromise your professionalism. What do you think I mean by that? What do you think I mean by avoid relationships that can compromise?
Don't date somebody on your team.
Pardon?
Don't like date somebody that you're working with.
There you go. Why would I not want you to date somebody that you're working with?
It caused tension in the room and working as a team. and
What
all that.
happens if you break up? What happens if you're dating for like, let's say 6 months and you break up? They're still on that team. You still have to treat them. Okay? You still have to treat that athlete. You still have to take their ankle. You still have to give them water. You can't say, oh, I don't want to give you water because we dated and we broke up and it really didn't work out, okay, so I'm not going to give you water. They're going to come ask you for water. You can't say, oh, wait a minute, let me go get Catherine, she'll give you water. You can't do that. Okay? You can't pick and choose that way. So, act professional. Avoid relationships. Okay? Be aware of sexual harassment issues. It's kind of a big deal. Kind of a big deal right now. Sexual harassment issues. Okay? So, try to keep yourself out of that situation. Try to avoid that situation at all costs. Okay? Maintain confidentiality. So, maintain HIPAA. Okay? You're an athletic trainer. You're a certified athletic trainer. You are HIPAA compliant. You have to be HIPAA compliant for our profession. If you don't maintain that, you can get in huge trouble. Okay? Develop a mission statement, a vision statement to focus on the direction that you want your program to go. So, when we first decide we want to develop a program, okay, there's things that we have to determine. Okay, so we've decided, say at Butler Community College, say we're not a community college, and we're wanting to develop an athletic training education program. Okay, we first off have to determine why there is a need for a program. Why there's a need for a program? Why would you think there would be a need for a program? Why?
Because a lot of students want to do it.
Okay, students want to do it. We have athletics, don't we? So we need athletic trainers.
Need help.
We want students to help us. But my job as an athletic training educator is to develop you guys into future certified athletic trainers. That's my job. So the need might be, I've got kids that want to learn, I've got kids that want to do this, and we're developing a program for our athletic teams, right? We're developing a program for our college. Determine what our goals are going to be. So we got to set goals. What are our goals going to be for our athletic training program? Okay? We got to determine and decide who our administrators are going to be. Who are the people that are going to be the administration for this program? 9 times out of 10, the person that wants to develop the program, that wants to bring in an athletic training education program, they're going to be the program director. Okay? Pete at Sterling, when he started the athletic training education program 20 years ago, he decided he wanted to start it. He had to go through all of this stuff, and he's the program director because he decided that he wanted the program. he determined the need. He determined the goals. So then he is going to become the program director, right? And then we got to develop a mission statement and a vision statement. Mission statement. What is the overall mission of athletic training? Of what we want to do? What's the overall mission of Butler Community College athletic training?
Care for athletes.
Pardon?
Care for athletes.
Yeah, so care for athletes. We want to care for our athletes. We want to develop future athletic trainers. Okay? So that's our mission. Our vision is where we want to be in the future. Our vision is where we want to be, where we want to move to. Okay? And then we got to figure out cost effectiveness of the program. Is the program, can we develop a program and be cost effective? Okay? Most routinely, we have to routinely examine the most effectiveness or the cost effectiveness of operating a healthcare program. So, very periodically, we need to figure out, okay, is it still cost effective for us to operate, to have this program? Or are we just wasting money? Are we spending the college's money and there's no return? Okay, there's no return. Okay? So, develop a policy and procedures manual. Again, it's stopped. Don't. So, develop the policies and procedures manual. So, create the policies and procedures for a very involved healthcare profession. Okay? So, you have to create a policies and procedures manual. Okay? Your policies need to be clear, written statements of basic rules. So I'm done with this thing. So, develop your rules, and they have to be very clear so everybody understands what the policies and procedures are for your athletic training education program. And then a procedure is going to describe how we're going to go about that process. Describe that process. Okay? So our policies are our rules, our guidelines that we must follow. Procedures are how we're going to follow them. Okay? Does that make sense, everybody? Procedures are how we're going to follow them. Okay? Issues specific to secondary, college, or university settings. Okay? One of the big things that we need to determine with athletic training, what is our scope of practice? When I talk about scope of practice, I'm talking about who are we serving? Okay? Scope of practice for the athletes, scope of practice for the institution, scope of practice for the community. So, at a secondary setting, at a college setting, our scope of practice is serving the athlete. Correct? We don't necessarily serve the outside population, the general student. Okay? We don't necessarily serve them. So, if I had a student come down, they're not on scholarship, they're not an athlete, they come down and say, hey, I think I did this and this and this to my leg, I legally should not look at them. Okay? Because I'm not here, I'm not serving them. Okay? So I would at that point send them to student health. Okay? And student health would refer them on to somewhere else. Okay? Am I serving the community? There are some athletic trainers that serve the community. They may be employed by a community outreach program or a community fitness center. So you may be employed by that. So you're serving the community. Okay? Coverage, college versus high school. What do you guys think the biggest difference between serving college students as opposed to high school students? What do you guys think?
Respect.
Okay, respect. But what would be the biggest? What would be another one? Okay, think about high school. Okay, how old are you in high school?
You're minor.
When did you graduate? Or how old were you when you graduated?
18.
Okay, so you just became a legal adult at that point. So when you're in high school, you still are dealing with having to communicate to parents. You have to gain permission from the parent before you do that. I can't just send somebody in high school to a doctor. I can't send them to the doctor that I want them to go to. Okay? I need to call the parent and say, hey, Johnny did blah, blah, blah. I recommend he goes to the doctor. The parent is the final say. Okay? Here, at the college level, most of our athletes here are over 18. Okay? So we have a little bit more leeway of what we want to do. If I want to send an athlete to Dr. Bruner, I can make that appointment for them. Okay? I can make that appointment for them. Okay? I don't necessarily have to call the parent to say, hey, I think they need to go see the doctor. Okay? So that's a huge difference. Okay? A lot of places will set up AT clinic times. They might set appointment times for those athletes to come in, for those patients to come in. Okay, so you're going to set up an appointment time. It's very important, however, to set up hours of operation that you're going to have for the athletic training room. Okay, the athletic training room is open from 8 o'clock to 6 o'clock every day. Okay, so important to specify those times so that the athletes and the coaches are aware of all that. Okay. What sports are in most need? What sports do you think would be in most need here?
Football.
Okay. Why would you say football?
There's more injuries in football than most sports.
True. What are some other ideas or other thoughts on sports that would be in most need here? As far as, let's say, treatment is concerned or athletic training coverage is concerned. Would everybody pretty much say a consensus on football? You guys are probably right. Okay? That's not saying we're not caring for the other sports. It's not saying that at all. How many are on the baseball team? Yeah. Okay, so 2025. Anybody want to take a guess at how many are on the football team?
80.
Over 100.
Over 100. Over 100. Okay? We have an 85-man roster. We can have 85 people suit up on our sideline. That does not include red shirts. Okay? So I think maybe fall camp last year, maybe 120, 130. Okay? Dwindled down. We cut quite a bit, but it dwindled down to about 110 maybe. So we're well over 100. So yeah, football is going to be a huge need. They're going to need a lot of attention. That's why it's crazy busy in the fall. Once football's over, there's a lot more time because then we're dealing with men's and women's basketball, baseball, and softball. Okay? Then spring football starts up again. Okay? Track. Did you say track? Yeah, track's going to have a need. Okay? But honestly, their need is going to be more preventative treatment, preventative stuff. Okay? So, determine a need. Okay? Set up hygiene and sanitation guidelines for your athletic training room. Why would it be important to set up hygiene and sanitation guidelines for our room? What?
A lot of people like in and out.
Okay. Are we just an athletic training facility? Or are we a healthcare facility? We're a healthcare facility, right? So, if we're a healthcare facility, how many times do you guys go into a doctor's office and see a lot of dirty tables and utensils around? You don't. Doctors are always either scrubbed up, wearing gloves, masks, what have you, and they're constantly cleaning. So a nurse comes in afterwards, takes that paper stuff off the table, wipes the table down, puts a new one on, right? So why shouldn't we have to do that? We are a healthcare facility. And especially right now, with COVID, we have got to make sure that room is clean. And you guys have heard me say it downstairs. Every day we leave, every single surface is wiped out. Every single surface needs to be wiped out. But that should not be different from what already happens. That should happen every day, regardless of COVID or not. Because we're still dealing with people coming in with the flu, sick people coming in. We're still dealing with staph, MRSA. That stuff is still around. Just because COVID is here doesn't mean that stuff isn't around. Okay? So we should be cleaning tables every day, multiple times a day. As soon as a sweaty athlete gets up off the table, or an athlete in general, sweaty or not, gets off the table, clean it. Wipe it down. Okay? That's very, very important. Okay? Do you think it should be important for an athlete to take a shower before they get in a cold tub? Yeah. Why? Why would that be important? Okay, so we have a football player just come in for football practice. 2.5 hour football practice. Full pads. Lost 12 pounds. Sweated their butt off. You want them to get in the whirlpool? No. If they do, what's that whirlpool going to look like? It's going to be gross. It's going to be foggy. It's going to be nasty. Okay? I'm not saying that doesn't happen here. Okay? It's very hard for us to make sure everybody showers before they get in a cold tub. It's very hard. Especially when our athletes don't shower after practice. They don't really use their locker room to shower. A lot of times they'll come in, jump in a cold bath, and then go to the room and shower. Okay? So, it's very hard for us to regulate that. But if they do get in a cold tub before they shower, what would be important after they get out of that cold tub? Okay? Drain and sanitize it. Right? Drain and sanitize. That would be very important for us to do. What do you think some other hygiene and sanitation guidelines should be for the athletic trainer? Obviously, you can see this stuff right here, but throw out some other things that you think would be important. Anybody have any ideas? Okay. Why do we say no food or tobacco or smokeless tobacco in the athletic trainer? Why do you think that? You're treating people. Okay, so why do we want food floating around our athletic trainer? Or why wouldn't we want food floating around our athletic trainer? It's not sanitary, right? Okay. Now, again, does that happen here? I'm not saying that we're perfect. We aren't perfect. Okay? We don't run the tightest ship athletic trainer room in the world. I guarantee you that. We still have our athletes come in and have food come in. It's very hard to tell an athlete they can't bring food in, especially if they go from, let's say they get out of class at 12:30, and they've got to be at practice at 1:15. They got to eat somewhere, but they need treatment before practice, right? So they're going to leave class at 12:30, go get food in the caf to go, then come down and get their treatment and eat while they're getting treatment so they can go to practice. That happens quite a bit. Okay? It's very hard to tell an athlete they can't do that because they also need to eat. It's very important for them to eat before they go to practice, correct? Yeah. So it's hard to say that you can't do that. Now, smokeless tobacco, that's easy. Don't chew in the athletic trainer. Okay? Why would we say shoes must be kept off treatment tables? Dirty. You get a bunch of dirt on the tables. Okay? Why would we say cleats off the tables? Same thing, but why else? rip a hole in the table. Okay. Okay, so no roughhousing, profanities in there. Why would we say no roughhousing? Don't want anybody to get hurt. Okay, you're in a facility to get treatment because you're probably hurt. So getting hurt in the athletic training room is just, that doesn't make sense. You come down to get better, but yet you leave hurt. Doesn't make sense. Okay? Okay, so some responsibilities. What would some responsibilities of the athletic training student or athletic training staff be? Just give me some responsibilities. Throw them out there. Okay, clean off tables. What else? Say again? Ice. Okay. Let's talk about cleaning responsibilities. Okay. So clean off the tables. What else? Sanitize. Make sure you guys are cleaning, washing your hands all the time. Okay. So we have got to differentiate between what our responsibilities are as opposed to custodial staff responsibilities. Okay? Custodial staff sweeps floors daily. I'm not saying we wouldn't. We would still sweep the floors. If the floors are dirty, sweep them. Okay? Clean and disinfect the sinks and the tubs. A lot of times custodial staff will come in and they will disinfect our tubs. Okay? They'll clean that stuff. It's not a bad idea for us to do it either. Okay? It's disinfecting multiple times a day is not a big deal. Okay? So, but their job is to come through and clean things, correct? Like take out the trash, mop the floors, all that stuff. So our responsibilities would be clean the treatment tables, disinfect the hydrotherapy room, the tubs, the modalities. What are modalities? What are modalities? Anybody have an idea? What? Yeah, so like our stem, our ultrasound, that kind of stuff. Those are modalities. The cold tubs are modalities. Okay? And then clean the equipment